Welcome back to Revitafest. I am here with Dr. Rich Joseph, who is going to talk to us about performance medicine, what it is, and explore exactly how you can integrate it into your life. Welcome, Rich. It's so good to have you here.
Thanks, Karen. Really great to be here. Thanks for having me. And thanks for the opportunity in this stage to sort of introduce the concept of performance medicine. Before I get into it, I wanted to share a little bit about maybe myself, my background, like why I'm even talking about this and why it's become such an important part of my life philosophy and my clinical practice is I was, an athlete, certified trainer for a long time, and back in the day. And so, life has always been my sport in many ways, right? I think after being an athlete, you realize that like life is the hardest sport of all, and you need to continually adapt your tools and training to do well and to excel. I'm also a physician. I trained in primary care and internal medicine, and so a lot of my professional journey has been about bridging the gap between the health and fitness industry as well as traditional medical care. I think all of us intuitively understand that those two worlds should be connected, and right now they still remain quite disconnected. And then since being done with my training, I was fortunate to open my own clinical practice that provides sort of comprehensive and holistic proactive health services for my clients. And then I've also worked in a number of underserved communities to help bring some of those same programs to life around sort of healthy lifestyle for folks who may not be able to access, clinics like mine. And now I'm working to take pieces and lessons of what I've learned in my clinical practice and figure out how do I protocolize some of these at scale in my work as the Chief Medical Officer for Restore Hyper Wellness. And for those who don't know, Restore integrates various wellness therapies and medical services like cryotherapy and sauna, hyperbaric oxygen, and others under one roof. And it's now, 240 locations and growing across the country. So a real opportunity to think about how do we scale some of this proactive health approach. Um, Karen, I know you know, but like I'm all about empowering individuals and communities, right, to grow and develop confidence and agency around their health. And really, this is my life's mission, and really committed to figuring out how to do this work across multiple dimensions and across multiple levels, because I think that's what it takes to make change. So before I talk about what performance medicine is and how I practice in the way that I do and how it might be applicable to others, I think we all need to level set, right? That many of us understand, like the current medical model is both disappointing and it's deficient in many ways, right? I would
Yep.
argue that the critical years when an individual really, is learning different health behaviors and those are crystallizing often receive the least expert attention, even though we know that those behaviors are what drive people's health outcomes. Um, Particularly I'm thinking people in like their late teens to 50s and 60s. I mean, I can talk about myself specifically, right? Like even as a primary care doctor, like I don't go to primary care. I don't see a primary care doctor, right? And I don't get much value out of primary care because thankfully, like I am healthy by sort of most standards, and even primary care is still sort of reactive to disease in many ways. And so we really only engage healthcare later in life when disease and prevention really seeds ground to disease management. Um, and rarely, I would say, does routine care actually provide like an actionable plan for people, behavioral strategies, guidance on how to actually maintain and improve health, which I think so many of us are seeking. Um, and so, unfortunately, for most people these days, myself included, and many of you out there, most people are really left to figure it out on their own, right? You're sort of putting together a bunch of different strategies, cobbling together different solutions from the world of health and wellness, which is not bad, but it's a pretty fragmented industry, and it could be a bit of a wild west, right? So we're sort of left without much guidance, I would say. And preventive medicine in particular, preventive medicine is actually a discipline within traditional medicine, but it makes up less than 1% of the overall medical workforce, right? And it's become much more of a research discipline than an actual clinical practice. And so the very concept of prevention itself, I would argue, is hypothetical for people. It's too distant in the future. We're not wired as humans to really care about that. It's not particularly pertinent. It's not pleasurable. It's not persuasive, right? Um, and so I would argue that preventive medicine is not living up to its mission in many ways. And I think the stats tell the story, right? 9 in 10 Americans are, metabolically unhealthy. 6 in 10 Americans have at least one chronic illness, with nearly half suffering from multiple chronic illnesses. And so clearly we're missing the mark. And so that's where performance medicine sort of comes to me as a term that I'd like to get out there and define a bit more for people. And you know, I worry that the term performance medicine has become a bit commercialized now. It's become sort of synonymous with hormone replacement therapy or peptide therapy, or a lot of these, these other trends that are out there on the market. And so my hope is to, use the term to provide a bit more of an expanded concept. It's both a care philosophy as well as a clinical model. I think both are really important to help usher in sort of a new paradigm, because I think all of us need to work together to really reconsider what it means to be healthy and what we need from our healthcare. And so before diving in, I just want to like contextualize why now, right? And I like to, Karen, like I'm pretty like humility is important to me. Like I'm not here trying to put my name like on this or own this as like entirely new discipline, or act like I have some revolutionary breakthrough, right? Like in biomedical sciences that's going to keep us all healthy and expand human lifespan. But I do think it's really important to codify this shift from sort of more of a reactive to a proactive approach to healthcare. I think it's essential for establishing legitimacy that can really help the trend propagate. It can help influence medical training and practice, and ultimately, we need to codify in order to impact changes in health policy and financing and delivery that are needed to really change the way healthcare is delivered in this country. And I think now is the time, right? Like consumer behavior is changing around healthcare. People want to take more agency around their health. You have many more direct to consumer options out there that people are availing themselves to now. And I think, the pandemic itself really brought health to the forefront of our collective consciousness. And I think that trend is here to stay. And then there's also this parallel trend around concierge medicine and more doctors or practitioners like myself sort of going out there on their own because we want to break the mold from sort of the traditional insurance-based model in order to offer a more proactive approach to people to people in their health. And at the same time, you have sort of this democratization, thanks to folks like you and a setting like this, of health information, right? Of you have podcasts, you have social media, you have forums, so people are engaging with their health in new ways and seeing different paths and realizing that there are more options out there than maybe what's presented to them, in their traditional medical care. But right now, I would say a lot of these trends are fragmented, right? It's like highly commercialized in many ways, and it's really like sort of persona or influencer driven in many ways. And so my hope is to if we want to create lasting change and really usher this in as a new paradigm of proactive health, it's important to codify the principles and really define an ethos and an approach that ultimately can then cement as a new care model. And so for me, performance medicine starts off as a philosophy, right? Before I even think about like what is the clinical approach, or like how does this look in practice, it's really predicated on the thesis that the critical practices that you use to enhance your daily well-being and performance, which I'll define, are also those same practices that are going to most likely increase your health span, right? The period of life that you remain healthy, as well as even your lifespan, the amount of time that you have on the planet. And so let's define performance broadly here. I know that that comes with sort of like an athletic sort of sports connotation in sort of our lexicon, but I'd like to sort of push the definition broader as one's capacity to bring energy and attention to what matters most, right? Especially in a given moment. And I would argue that our energy and our attention are really the essential currencies to experience a fully engaging life, right? To feel engaged in life, really for whatever amount of time that we're blessed to be here on Earth. Um, and yeah, this requires some deep digging from people to really then understand, right? Like if you want to if you want to help people enhance and sort of sustain their performance, but what does that mean to you, right? And that means that we have to actually understand an individual or client's value system. We have to understand their beliefs, whether conscious or subconscious beliefs. We have to really dig in, understand their priorities, which change throughout different, life stages. So what does it mean for them to perform right now in their life? What identities are sort of most important to them? Therefore, like what actions, habits, daily practices that they actually need to develop or delete, right, in order to direct their energy appropriately? Did they need to actually, are they suffering from a lack of energy? Do we need to work with them to actually enhance the amount of energy that they can bring to their lives? Or do they actually need to manage their energy more strategically? Right? These are all sort of questions that I think are important to address. And so the performance medicine approach, as I practice and would like to define it here, really focuses on the immediate and actionable imperative of improving and maintaining one's physical, mental, and emotional performance every day, right? And so that's like very tangible for people. It's very salient. right? As opposed to something like prevention. Um, and especially for people who are maybe at low risk of disease, or maybe, they might be managing a chronic illness, but they don't need or require sort of traditional disease-based episodic medical care, right? But they do need the proper tactics, the skills, the support to actually improve, daily performance while also hopefully sustaining that long-term health. Um, and as I mentioned, the practice really does employ like a values-based approach that begins with this discovery process to elucidate someone's deeply held beliefs about their health status, their life mission, their goals, visions for optimal performance. What does that really look like? Their motivations for change, right? And that's some deep work, right? That I think all of us need in order to really sort of push our health forward. And so when I think about the clinical, if I could spell out like clinical objectives for performance medicine as I approach it with my clients, like it's threefold, right? So the first one would be to increase the individual's adaptive capacity, and I'll define that throughout life, sort of with personalized training of both the mind and the body. And so adaptive capacity really refers to the ability of a person and sort of their physiological systems to manage internal and external challenges, right? Really to turn stressors into opportunities for growth. Um, and I think that's a really interesting concept because really what we're doing is we're employing sort of strategic dosing of stimulus paired with recovery to cause sort of adaptive growth in areas that are aligned with someone's long-term goals, right? So that doesn't necessarily mean like physical growth. That could be emotional, spiritual, sort of whatever ways people want to grow. But in order to grow, like you have to challenge yourself, right? And so helping clients find comfort in discomfort is sort of one of the common themes to practice, and using this concept of sort of hormetic response, right? It's like, there's this idea that the dose is what makes the poison, right? And so you have to appropriate apply different doses of different stimuli in order to help people grow in the right ways without it becoming toxic or sort of maladaptive for them. And the idea, the sort of premise here is that you're never static, right? Like you're either growing or you're atrophying in different parts of your life. And the whole idea is to be intentional about that, right? We're not going to be growing in every direction, every dimension at once. There are going to be certain trade-offs and prioritizations that have to occur. And that requires sort of coaching and partnership. And then the second objective would be to employ behaviors and therapies to increase the individual's likelihood of postponing physical decline, right? Preventing disease, protecting against injury, right? So that means using the lifestyle behaviors, the diagnostics, the preventive prescriptions, and sort of other adjunctive therapies to help people. And then ultimately, and sort of more aspirationally, it's about instilling a sense of agency and well-being, right? That positions an individual to contribute beyond oneself, sort of to the betterment of society and to people that they care about, right? And I think we would all argue that sort of health and having energy is critical for being able to do that. And I'll say in my practice, and our model really seeks to make physical activity like the core pillar of care for each client. Uh, and I'll tell you why. Obviously, like I'm a fitness buff, but it's not just that. I think all of us understand, and more data shows that exercise is yes the most probably potent prescription out there to improve people's health overall and longevity. But I would argue that it also serves as sort of a medium for exploration to really explore this concept of adaptive capacity and other demands of life, and to approach, and it sort of grants this approach to self-development that prioritizes patience. It teaches about incremental progress, the idea of, valuing process over outcomes. It teaches about energy regulation. It teaches about delayed gratification, right? So you can learn, I think, through sort of physical training. These are all sort of fundamental practices and lessons that I argue you need to learn these things in order to pursue health in the modern world, in the world that we live in, which is really wired for instant gratification, and unfortunately preys on sort of our hedonistic impulses in many ways, right? And so I think, physical training really confers these lessons that translate to other domains of life. Um, and so uh, in my personal practice, as I've built this out over time and think about sort of what's the best way to deliver this to clients, right? It includes, very thorough intake, right? Fully detailed, fully detailing someone's unique physiology, their psychology, and their personal preferences, right? And so understanding someone's baseline health status, all the lifestyle factors. So, patient report, health records, wearable data, et cetera. the biometrics, the biomarkers, the biomechanical evaluation, fitness assessments, et cetera, that sort of like really holistically capture someone's baseline health status. Um, and based off of that, then we're able to sort of work together. And it's really a co-creation with a client, right, to put together a personalized sort of performance plan that we call it. And it's meant to be very actionable. Um, and supported ongoing with coaching, accountability, and like interval monitoring, interval testing as well. And it's also meant to evolve. It's not meant to be static, right? Because people's priorities change over time. What they want to work on changes over time. What they care about changes over time. So it needs to be adaptable. Um, and I would say the other thing that's a key component of the practice is access to a network of specialist practitioners. And so that, yes, includes sort of traditional MDs and even, naturopathic physicians and others, but also trainers, dietitians, physical and massage therapists, cognitive behavioral specialists, people, who are meant to surround someone to really think about their holistic health and how do we coordinate and communicate to really serve the client best. And so I know this, like, sounds great. It sounds like very aspirational in many ways. I think we all would love to sort of have our healthcare look like this and know that it should in many ways. And so I also obviously think a lot about access and equity as I think about this model and how do we democratize this over time. I'm a realist, right? And so understand that this type of practice that I created, it begins as sort of an elective clinical service, right, for a demographic with an ability and a willingness to pay. But if we're really going to codify a field or discipline around performance medicine, I think we really need to, from its infancy, focus on access and equity and not let that get lost in the conversation. And just a few ideas of how to start that, and some of what I've experimented with in my own clinic is, how do you, if you want to offer this type of service for a certain number of clients, can you also offer like group-based performance medicine programs, right? And that provide education and peer support and connections and sort of like community-based wellness settings and healthcare resources and community spaces, things like that. My clinic actually uses like a rev share model where a portion of the revenue that's generated through my clinic actually goes to support the operations of a partner nonprofit that I started here in Boston. And so making sure that there's that financial link up front, I think is really interesting. And then over time, can we test sort of income-based fee-for-service business models that subsidize services for lower income brackets, I think is really important. So I think we can't lose sight of access and equity, even as we try to bring this to the mainstream. And so I had to, sum it all up. I would say, like, in a nation, I would say, of disgruntled patients, disillusioned providers, and deficient healthcare, performance medicine, I hope, it's it's an aspirational approach, but I think it's also quite practical. And my hope is that it's an inclusive ethos, right? It's not meant to be, some new discipline that is supposed to stand out and separate from all that exists. It's meant to be inclusive and bring together different um, lessons and clinical approaches, whatever serves the client best. Um, and ultimately, I'm here to really help encourage and educate like-minded providers to help design their own performance medicine practices and to work with and inspire health-conscious clients to seek out similar care models like this that sort of that leverage the tenets of performance medicine, under the collective belief that we can all achieve, healthier and vital lives if we're able to push in this direction, towards a more um, performance-oriented way towards healthcare. So I hope that sort of summarizes it. And thanks for letting me be here and present that to the group and get it out there. I really appreciate the opportunity. Thank you.
Rich, thank you so much for that incredible presentation or talk, whatever we want to call it. I love that you are. I know you are. You. I know you. You are incredibly humble, but you to me are like the speaking of hope in this performance medicine space, right? And in this democratization of healthcare. And so I cannot thank you enough for what you're doing to help us as individuals, because I am one of those people that will be a patient, right? Understand what agency means when it comes to healthcare. And so, for putting together this framework, I just want to commend you and say that I'm so incredibly grateful for all you do and for being a part of RevitaFest.
Well, thank you, because the only way that it's going to come to life is if other people learn about it and want to learn more and get involved in sort of helping to bring it to life, right? It can't just be me. So thank you for the opportunity to be here and to share it with everyone.
Perfect. Well, let's do this. Let's join. We want to join your mission and just make it powerful. Thank you
Thanks,
so
Karen.
much, Rich. It was wonderful having you.